You're right. I did see the pop-up there.
Okay.
Let me know when you'd like me to admit.
I think we can go ahead and admit. It's 10:30 right now.
Okay.
10:31 actually. Good morning, everyone. Thank you for joining us. We are going to be giving some instructions in just a few minutes. So you should be seeing some stuff in the chat when you come on in about putting your name and email address and your affiliation, your organization. We'll get started here in just a minute. Thank you so much for joining us today. We have a few people still coming on. Okay, good morning, everyone. If you're just coming to join us right now, we're going to get started here in just a minute or two. We're just waiting for additional folks to join us. I see when people are entering the waiting room, so we're working on getting folks added. If you are just joining us, please go ahead and put your name, your email address, and your affiliation, your organization directly into the chat. I do hear some echoing, so if you could please put yourself on mute, and then that will help to avoid the echo. Thank you. Okay, I think we're going to go ahead and get started. Kaylee and Bruce are here with me. Kaylee is going to be helping to monitor the chat, and also will be, you'll see some periodic links that will be added to the chat box for you to be able to follow along with. So Kaylee's going to be doing that as well. Thank you, Kaylee, for that. And also Bruce Robbins will be helping to do some of the slides with me too. So we'll be switching off between Bruce and I. I also see that we have some of our colleagues here. Thank you so much for joining us from our compliance team and our revenue management unit as well. So, but you'll see that we're going to first do some housekeeping items. If you're just joining us, please go ahead and add your name, your email address, that's really important, as well as your affiliation. And thank you so much. You are here right now. We're doing the Request for Proposals virtual pre-bid conference. So hopefully you're in the right spot. We are going from 10:30 to 12 today. Okay, so some housekeeping items. So the conference is being recorded. So hopefully you got a pop-up window and you'll see that the recording's happening. We are going to be using the chat box during this presentation. It's really critical for you to be able to access the chat. So we wanted to make sure that you saw how to access it if you haven't had familiarity with Zoom. So it just should be a bottom menu. You can access it by clicking on the chat button. Also, if you have or need to raise your hand, you'll see that there's under the reactions, there's an opportunity to just click a button to say raise your hand, and you would also click it to lower your hand. So we'll be using that during the end of the session. We'll have a time devoted to Q&A, and we'll ask that you use the opportunity to raise your hand feature. And again, Kaylee will be helping to monitor that as well, so I don't miss anyone. So that's kind of the basic housekeeping. We're just glad to have you here with us today. The chat box important because not only will you be adding your name and your email address, but we're also going to be asking that all of the questions you have are written into the chat. we're going to save time at the end to actually have some time to ask some questions, but we're hoping that you can please enter all of your questions directly into the chat. And so we have a record of them. So we're wanting to keep that. So it's going to be helpful for us as we do the official response to the questions. All right. So I talked a little bit about the raising hand feature in the chat. This is what the chat box looks like. You can select who you want to send it to, and then you just click enter and it should appear there. So it looks like everyone's got a good handle on chat. If you have any questions too, you can also reach out to Kaylee, and Kaylee can support you through that as well. If there's any technological issues or anything you encounter as you're going through it. So we're doing welcome and inductions. We're asking folks to just put their names, their email addresses, and organization affiliation into the chat box, as I already mentioned. So, and if anyone comes on late, Kaylee will go ahead and be entering them or adding them to the presentation, and then just reminding them to do that as well. As I mentioned, my name is Melissa Struzzo, and as of just end of last week, I've been appointed the new SUD and Recovery Services Section Manager. So hopefully you all got the thanks. Hopefully you all got the notification from Bill this morning about that. So I'm really, really happy to be in this role and to support the community, and excited to be supporting all of you as well. So, so I have to officially change the slide deck, it looks like. And then Bruce is here with us, Bruce Robbins. He's an Administrative Services Officer 1 with us, and he'll be, like I mentioned earlier, be switching off with me on some of the slides. So thanks, Bruce, for being here. And Kaylee Fabella is here with us as well, and she's our administrative aide for the SUD section. So thanks, Kaylee, and all the support both to Bruce and Kaylee for this as well. Okay. All right, so we're going to start with the supplier portal, and I'm going to turn it over to Bruce. Bruce is actually going to walk us through this. So Bruce, I'll turn it to you. You're on mute.
Thank you very much. Yeah, just everything's going to for the RFP does go through the purchasing division's supplier portal. So in order to access that, you have to register with them. And so I'm going to go ahead and just in 1 second just show you what the site looks like if you haven't already accessed it. Let me go ahead and call it up here. I've got it waiting. Let's see. There we go. Okay, so let me share my screen. Okay. So you're seeing the web page here. Yeah. So this isn't the actual supplier portal. This is the page for the purchasing division's website where you can access the supplier portal. We also have a direct link as well. That's what this one right here is. So if you click on that, you get to this page. And so and this is the main page where, like, if you weren't already registered, you would click here to register. And then if you're a vendor, you may need to provide some information like a supplier ID. And so if you don't have that information, then let us know, and then we will get that information from you from our enterprise financial system and get it to you. But you will need that if you're a current supplier to register, if you haven't registered already. And then there's also a thing I was going to point out, which is very important, is they have an extensive frequently asked questions section here, and it's quite useful. All kinds of different things about registering, problems you might encounter, and about submitting information, how to submit the information, how to download the information. And then another thing that's important, which I was going to point out later as well, is that ultimately, if you're having any issues, they do have a help desk. It's the supplier desk email here, which I've got also in the PowerPoint as well several times. And so if you email them, they'll be able to help you with issues you're having with access. And then what you would do is you would sign in, and I'm going to go ahead and do this just on another screen here really quick, but it's just, let's see.
And while you're signing in, Bruce, I just wanted to remind everyone that we are going to be posting this PowerPoint. And so, Kaylee, can you go ahead? Kaylee's going to put the link of where you can see the PowerPoint, but also Bruce mentioned this email address for the Supplier Portal if you need help. So Kaylee, if you could also add that to the chat, that'd be great. So we're going to be putting in the chat for you the link, the email address, if you have any issues accessing the Supplier Portal or even just using it throughout. And then also Kaylee's going to put a link where you would find the posted PowerPoint for this today. So thank you.
Right. And so once you do log in, there's some additional instructional documents you can access. But if you wanted to begin, you would basically, you're going to want to find, might take a second to show. Let's see. Oh, there we go. Okay. So this shows all the RFPs and RFQs, et cetera, that are open for the county. So this is the one that we're looking at for substance use disorder services. And so if you wanted to download the documents for this, you would select download documents, and then it brings up a screen here where you can select which documents you want to. So basically, there's a number of different documents here. These are actually information, how to view solicitations, registration guide, et cetera. But the RFP itself would be right here. That's the main RFP document, and then there's the attachments. So what you do is you would go over here to view, and then it would come up, and then you can open an Acrobat, or you can save it, do a save as, and save it to your local machine or wherever. So that's how you access the documents. You'd go through all the attachments and everything, do the same thing, and download those, and that's how you download. And then when you're ready to upload, then you can do, let me see here. Same thing here, upload documents, and let's see. Oh yes, this is when you're adding files here to upload. It's in the same place. So once again, if you're having any issues, we're going to talk a little bit more about format and et cetera later. But there is that help desk for the purchasing division and the portal that can help with that. So let me get back. Do you want to get back to the slide? Let me stop sharing. There we go.
Yes, let's get back into the slide. So okay. All right, then 1 second. Didn't work on that one. I'll try again. All right. Okay, hopefully you all can see the slide deck. All right, so Bruce, that was Bruce talking about the Supplier Portal, really just how to access it. Hopefully you've already all had a chance to see it, and that you're coming here having had a chance to already review the documents, and that you were able to download what you needed. If you did have difficulty, hopefully you were also able to get the help you need to get on. But again, if you do need, there's that email address to connect. So this is where you'll be adding and submitting your documents as well. So let me move on to the next slide. And there was a question about this, Bruce, in the chat that I saw. I was just asking about which documents that the individuals will need to download. And I think we're going to provide a little clarity about that as we go through, depending on what budget templates you might need and whatnot. So it may not hurt to pull all of it down off of there, but to add your specific questions. All right, next slide. This is for Bruce.
Okay, so this is just our agenda for today. We've actually gone through some of it already, the introductions and housekeeping. Then we're going to touch on the purpose of the conference and overview of various sections. And then we'll get into sort of the main part of the RFP, the scope of services. Then we'll talk about the actual content of the proposals and scoring criteria, and a very quick time to look at the or talk about the budget templates. And then we'll have some Q&A time at the end where people can submit questions. So the first item we're going to jump into here is the purpose of the conference. And so it is an opportunity for us to, the department, to provide an overview of the RFP itself, the requirements, including the service types, just the overall process and timeline, schedule as well. As has already been mentioned, questions are definitely welcomed, but we're asking that the questions be written in the chat box, because we will be taking all questions that are generated here, as well as all questions that are sent to the email address dhs-contracting@sonoma-county.org. And all those questions in writing will then be will receive written responses, and that will become a part of an addendum to the RFP, which will be then posted on August 24th. So just a summary. Yeah, please put your questions in writing in the chat. And also, aside from this conference, you should send all your questions to that email address indicated right there, the DHS contracting email. And those should all be done by 5 p.m. on August 17th. And then all questions will be responded to via this addendum, to which will then be posted on the portal. And the written responses there will be the final responses to those questions.
Moving on.
And so just a very brief overview here of the background. So we're seeking community-based organizations to provide a wide variety of SUD treatment services. We're looking at these main categories of services here: outpatient drug-free, narcotic treatment program, intensive outpatient treatment, adolescent treatment program, residential therapeutic treatment, perinatal residential substance use treatment, short-term recuperative care, and then case coordination for SUD court programs. So those are the main categories. We'll be going into a lot more detail shortly.
Yeah, and just to interject, I wanted to let folks to know that, like we said, we're going to post this, so don't feel like you have to frantically write notes. There's a lot of information on these slides. Some of the slides we won't be reading through everything. We just wanted it to be there available to you. You're also going to get our notes that are in the bottom right now that we're referring to. So you'll have access to those as part of the PowerPoint that's being posted. So I just want to make sure, give you guys a little a heads up on that, so you don't feel like you have to take copious notes, unless of course you want to. But so I just want to let you know we do have it all posted for you here. All right, moving on to the next part of the overview.
So this is just providing the structure of the RFP and how you would submit proposals. So so you may submit proposals for one or more service types, which is basically those categories. So you should definitely indicate which service types you're bidding on. And then, as you'll see later, or you may have seen if you've looked at the RFP, that there for each service type, there is an expected service level that we're looking for. And so you should indicate, how much of that service level, the percentage that you're proposing to meet. Are you proposing on meeting that full amount or some sort of percentage of it? And evaluation and scoring will be conducted separately for each service type. So so it is possible that a proposal could be selected for an award for one service type or more, but not necessarily for all the service types that you have in your proposal. So it is possible that you could be awarded part of what you're proposing, because it is sort of, like I said, scored and reviewed and evaluated based on the service types, the categories. And then it is possible also for multiple awards for a service type in order to meet our expected service level. So, so that's another possibility as well. Next slide.
It's up.
Okay. Yeah, so the very quick look at the term of the RFP and the funding. So there will be an initial 18-month term for contracts. It's going to start January 1st, 2022, and it's going to go through June 30th, 2023. And there is a possibility of one extension up to a maximum of 1 additional year. There's anticipated funding amounts, and this is for all the services included in the RFP. And that's listed here, 3.6 million for fiscal year 21-22, which once again, that's a partial year, sort of a half year. And then 7.6 in fiscal year 22-23. And this is subject to change, but that's what we have listed here. Just to clarify too, that the department does not currently operate under a drug Medi-Cal organized delivery system, ODS, DMC ODS. So this is not an ODS RFP, or this RFP is not for services for ODS. Just wanted to clarify that.
Okay, great. Thank you so much.
And our schedule. So this is in the RFP, but just want to go over it. You know, once again, it was released August 3rd on Tuesday, and we're currently in our optional virtual pre-bid conference. And the next sort of event coming up would be August 17th, which I just talked about before, which is for all those any questions sent to that email address by 5 p.m. on the 17th. And they'll all be collected, and we'll be issuing responses to all the questions by August 24th. And that will be in the form of an addendum to the RFP, which will be posted on the Supplier Portal. After that, then we have the due date for the proposals. So there's another couple of weeks after that, and then that's September 7th, and that's by 2 p.m. And that's very precise. It's got to be done. They have to be into the portal by that time. So you just want to make sure if there's any sort of issues or anything, you sort of resolve that beforehand, because that is a very strict sort of cutoff time for the proposals to be in. And then we'll have the next about week and a half or so as a period of time, September 8th through the 17th, where we'll be evaluating the proposals that are received, and if necessary, conduct interviews, finalist interviews to collect additional information if necessary. And then we'll be issuing a notice of intent to award. And then ultimately, like I said, the contracts themselves will begin January 1st, 2022. And these are subject to delay. That's noted also in the RFP that date is subject to delay as well, as far as the notice of intent to award. But the start date is pretty set, January 1st, 2022 for these contracts to begin. So that's our schedule.
And again, it's in the PowerPoint, so you'll see this. It's going to be posted tomorrow, as soon as tomorrow at the latest. We're going to try to get this up here and available to you, so you'll have all these dates for you.
Yeah. And as far as the format, so it is, we are doing everything electronically. In the past, purchasing, accommodated written, hard copy submissions, but that's we're no longer doing that. I think that had a lot to do with COVID restrictions, et cetera. So everything's going to be done through the portal that we went to. So it's one copy, one electronic copy. So no emailed or hard copy or fax submissions will be accepted. Mentioned once again, 2 p.m. on 9/7 is when they should be received to the supplier portal. The portal will accept PDF, Word, and Excel documents, but I wanted to specify that the preferred format for the proposals is PDF. That would be the preferred format, with the exception of the budget templates, because those are Excel documents, and those should be submitted in Excel. That would be far better than receiving those a PDF version of those, because there are it's just much easier for us to access that information in the Excel document itself rather than in PDF. So the proposal, most of the proposal documents in PDF, except for the budget templates in Excel.
Moving on.
And very quickly, so there are some requirements for how the proposal should be formatted, just for ease of review and facilitation or evaluation. So the proposals themselves should be no longer than 5 pages. However, we are saying that for each service type, there should be those should be no more than 4 pages. So general sort of organizational information, agency information, then that's 5 pages. But then in addition to that, you can have 4 pages per service type, because we are asking basically for a narrative and a lot of information per service type that you're bidding on. And it should be a single space, double space between paragraphs, 12-point Times Roman, 1-inch page margins, and then the headers and footers can appear outside of that. And that's not going to include the cover letter, letters of support, or the budget templates. That's just going to be the actual content itself that we're talking about with these page limits. So pretty standard, just so we have a succinct proposals that we're able to review, and 12 points, so that it's easier to read, etc. I think we're ready to move on to the next slide. Okay, so these are talking about, once again, this is all in the RFP itself, but just an overview of the general requirements. And I'm just going to go through these very quickly. The Department of Healthcare Services AOD program certifications. We're asking everyone to have those complete, and if not currently certified, then the contractor will apply and adhere to the standards until that certification process is complete. Title IX facility licensing regulations and certification of AOD counselors. There's some very specific certifications and accreditations for NTP services that need to be followed. Once again, if proposing those services. Minimum quality treatment standards for drug Medi-Cal and the substance abuse block grant need to be followed. Once again, if applying for those services, that's applicable to those to DMC and SABG, as we call it. The perinatal practice guidelines and youth treatment guidelines. We have in the RFP, we have links to those guidelines as well. So once again, if applicable to what you're proposing. And we also have the DMC and SABG special terms and conditions as attachments, which list out all of those requirements, and those will appear in the contract as well, the special terms and conditions. CalOHMs and SWITs. So those CalOHMs is California Outcomes Measurement System, and Sonoma Web Infrastructure for Treatment Services. That's our database that we use for this substance use disorder services. And so there's requirements for that as well. And there's more detail in the RFP on that as well. And in terms of location of services, this is listed in the RFP that it's got to be within a geographic proximity to Sonoma County that's acceptable to the department. So some service sites might be too distant for the department service needs. So that's going to be looked at as well. That you know, if something is just too far away, that's not going to be feasible for the services. Then that will be could be discounted.
Okay, thanks so much, Bruce. All right, so this is my section here. So moving on to talking about the scopes of services, the different administrative metrics for all the service types. And again, this information, as Bruce mentioned, is located directly into the RFP itself, so you can get a lot more comprehensive information. And as I mentioned, you'll get copies of these slides, and it's also listed here. So just to start off, that we are looking at the CalOM's admission and discharge information, and this would be completed in SWITS. We're also asking for the client assessment and individualized client treatment plans, and the discharge clients that given information and referrals for supportive services. So that's something we're asking for all service types. You'll see that as one of the required metrics. Continuing on, talking about the different scopes of services and different service types, I'm going to be going through and listing and talking about the different service types that are available that you could be RFPing for. So again, I'm not going to go into too much detail, and we will have time at the end to do some questions during this. But what we're asking is, if you have any questions right now, even up to this point, even about the PowerPoint, please put those in the chat. Kaylee's watching that and monitoring that, and some of them will be able to answer right away, which we mentioned earlier. There was one that came up already, but we really are running to capture this information so we can make sure to post it and make sure everyone has an opportunity to hear the different responses. So for all the service types, again, you'll see the RFP for additional information, but there is the core programmatic requirements. So these are all the activities that fall under that specific service type. And then there's also minimum program outcome metrics and the different referral sources. So that's all listed in the RFP in much more detail. So, and there'll be some in their notes as well, but most of it will be directly in the RFP that you can access. So starting with the service type number 1, there's a couple subsets of these different service types. So this is the overarching category of outpatient drug-free or ODF treatment. And I also recognize there's a lot of different acronyms in this, and it's probably familiar to most of you, but if you see something that you don't know or are not familiar with, just go ahead and let us know, and we'll also be sure to explain it if we haven't done so already. So in this case, ODF, we're talking about what budget template you're going to need, and this is going to be standard. I'm going to go through each service type, and I'll let you know what the different budget templates that are required for that. We also have, as I mentioned, some our awesome team from the revenue management units here, so there might be some questions around that. And we'll get to that too at the Q&A. But the budget template specifically needed for ODF is the SUD fiscal year 21-22 outpatient and DMC rates and costs. And that actually is labeled as attachment 15.2. So when Bruce was going through the supplier portal, that was one of the listed attachments that you could download and review from there. There are funding regulation requirements. So this, you would need to be able to bill for drug Medi-Cal for this. And that, again, these are all non-ODS. We're not an ODS waiver county. So this is specifically talking about the drug Medi-Cal state plans. All right, under this category, there are two subsets. There's either a general ODF, and this is a 12-month estimated level of service need that we've listed here. Again, these are estimated amounts, and we're looking at approximately 4,000 face-to-face visits under individual counseling, and roughly 16,000 face-to-face visits under group counseling, and approximately 1,000 unique clients that we served. Again, this is based on research that we did looking at previous years, going before COVID as well, trying to determine the trends of the different activities that were taking place already. So this is ODF General. Then there's also under ODF, this is another service type focusing on the Probation Day Reporting Center, also known as the DRC. And there are some additional programmatic requirements specific to this service type 1.2. And that's the fact that the services are being provided on site at the probation department offices. So they have to have the ability to be able to do that. Then talking again about the different service levels of service needed, we're looking at individual counseling at approximately 300 face-to-face visits. Group counseling, we're looking at approximately 1,500 face-to-face visits. and approximately 470 unique clients served. Again, these are estimations, so we're doing our best to kind of get to these levels. Now moving on to service type 2. This is our narcotic treatment programs, or opioid treatment programs, and TPs. And the budget template that you would be using for this as part of your application would be the SUD fiscal year FY 21-22 outpatient and DMC rate and costs. And that's again, attachment 15.2. And there are funding regulation requirements specific to NTPs, and that's that you must be obviously qualified to bill drug Medi-Cal, non-ODS. And these are the estimated levels of service that we're looking at. So we're seeing about 80,000 service units. So these are the 10-minute increments for individual counseling. We're also looking at the number of doses, and that's approximately 133,000 service units daily. And that's based on the daily units that occur. And then we're looking at approximately 450 unique clients served. All right, moving on to service type 3. I'm going to slow down a little bit. It's a lot of information. Again, all available to you in the slides. And if you have questions, we'll be making sure to get that to you. This is referencing the adolescent treatment program, service type 3, ATP. There are a few different budget templates here potentially. So you're looking at the SUD fiscal year 21-22 cost-based program, and that's attachment 15.3, also labeled and also part of that list of attachments available on the Supplier Portal. SUD fiscal year 21-22 outpatient and DMC rate and costs. And that again, this is 15.2 attachment. And this is for the DMC outpatient treatment costs, if you're able to bill DMC. All right, there are some specific funding regulation requirements. So again, you must be able to meet the substance abuse prevention and treatment block grant, or we also call it SABG requirements. And those were listed on that original list and in the RFP as well that Bruce referenced earlier. You would be able to actually get some additional points on the scoring when we're doing the scoring for the different applications that come in. If you have, you are qualified to build DMCs, that would gain you additional 5 extra points. And we're going to talk about the scoring criteria and that information a little bit later in this presentation, but I just wanted to get through the different service types before we get there. So that would garner you additional 5 extra points if you are qualified to bill at DMC. Then looking at the different levels of service needs, they're talking about here hours of outreach, looking at outpatient services, and we're saying about 170 unique clients served. And these are annual numbers, as you see, annual 12 months. All right, so this is service type 4. It's intensive outpatient treatment, or IOT services. This is like structured and supervised treatment for adults and potentially pregnant and parenting individuals if applicable. It includes like intake, admission physical exams, treatment planning, case management, individual and group counseling, collateral services, and crisis intervention. And the budget template that you're going to be using for this is our SUD FY 21-22, again, the outpatient DMC rates and costs. That's attachment 15.2. And this one does require that you are able to be qualified to bill drug Medi-Cal. Hopefully I'm going at a pace that we're all able to keep up with. It's a lot of information. So under there, this is we're still part of service type 4.1, part of intensive outpatient treatment. This is referencing for our SUD SUDS port participants. And so we're looking at about 110 annual participants that we are hoping to be able to serve. Service type 4.2, this is our perinatal intensive outpatient treatment. And this is requiring additional core programmatic components that includes childcare services as needed and transportation services as needed. Again, on the annual basis, we're looking at servicing and working with at least 20 pregnant and/or parenting individuals. And there are some additional funding regulation requirements. So this you must also be able to meet the SABG requirements for the provision of these services. And their perinatal guidelines are listed as part of the regulations as well. And you'll see that included in the RFP. Okay, moving on to the service type number 5. This is looking at substance use disorder court program coordination services. So proposals for this associated treatment, the outpatient and IOT residential services for these court participants would actually be included in the corresponding service type. So we're talking about case management, which is separate from the treatment. And this is really looking at the coordination of collaborative effort between the probation department, Department of Health Services Behavioral Health Division, and Sonoma County Courts. And this is really to help assist the individuals in reducing alcohol and substance use and reduce recidivism to the criminal justice system. So yeah, so this is something that you would be using the budget template, the SUD. Again, this is the cost-based program. It's attachment 15.3. All right, we're looking at service type 5.1. So this is the drug court program coordination. So it's around drug court. And we're looking at about annually 70 participants roughly that we would be serving. And again, this is based on some of our pre-COVID numbers. So we understand that there's some shifts happening. So that's the goal. We're trying to reach is 70. That's our estimated level of service. And this is looking at that one for drug courts. Moving on to service type 5.2, it's the DUI court program coordination, around 40 participants for that per year. Moving on to service type number 6, this is the residential therapeutic treatment. This is non-institutional, non-medical residential rehab services for clients with substance use disorder diagnoses, and that this is supporting their efforts to restore, maintain, and apply interpersonal and independent living skills and access community support systems. And the services, I mentioned them earlier, are similar to the IOT, and that's including intake and the admission physical examinations, treatment planning, case management. This also includes individual and group counseling and things like body specimen screens. So this is under the residential therapeutic treatment program. And that's service type 6. The budget templates you would be using for this is the SUD FY 21-22 residential rates and costs. That's attachment 15.4. It also has the board and care costs, board and care costs that cannot be included in this proposed rate. There we go. Funding regulation requirements for this, that you must be able to meet the SABG requirements for provision of these services. All right, this is 6.1. This is just a residential general, and we're looking at about 80 beds that we're hoping to be able to offer as our level of service need on an annual basis. Service type 6.2 is perinatal residential SUD treatments. These are services that are provided to pregnant and parenting individuals. And we're looking at about 15 beds on an annual basis. And there are some additional funding regulation requirements. This is another place where you might be able to get 5 extra points in the scoring if you're the service type, if you're able to qualify to bill for DMC. All right, and these are the non-institutional, non-medical residential rehab services that I mentioned before, and they're specifically for pregnant and parenting individuals and/or parenting. All right, service type 7. Service type 7 is short-term recuperative care, non-medical detoxification services, withdrawal management. So it's non-medical detox, and this is allowing our adults under the influence of alcohol or other substances to safely withdraw from the ill effects of intoxication. And services include things like assisted support, substance use disorder education, and treatment referrals. The budget template that you'd be using for this is the SUD FY 21-22 residential rates and costs. And this is the attachment 15.4. On average, on an annual basis, we're looking at about 10 beds, and that's up to a maximum of 3,650 bed days. Okay, that's through all of the service types we've gone through. I'm going to turn it back over to Bruce to talk a little bit about the actual content, the different aspects of the RFP that are needed. Bruce?
Okay, thank you, Melissa. So now I'm just going to go over the sections that are required in terms of your the format of your proposal. And so the first section is a cover letter. The next section is going to have organizational information. And it's going to be things like IRS status, a number of years in business, the core competencies of your agency or organization, and then also asking to list all the contracts that you currently have with the County of Sonoma. The next section is an organizational risk assessment section. So there's a series of questions here that are looking at fiscal and contract performance that you may have had with similar programs, and these other questions. And this helps to determine in your answers what the potential risk level for the county is in contracting. And so these are yeah, questions. They're going to. I think there's about maybe 17 or so of these questions, and they're pretty straightforward questions, so that is a requirement that we have to do is do this type of assessment as part of the RFP. Next slide.
Yep.
Qualifications and experience. So we're looking for your experience and specifically for the services that are included in the RFP. For your organization, and references, at least 3, once again for whom some similar services have been provided. Letters of support. We're looking for 2 for entities that you've collaborated with in the past. And then another section under this area is a compliance program. So we have some questions for information we want to know about your organization's agency's compliance program in terms of the policies that you have, your different processes that you have in place for internal auditing, credentialing, and just making sure that there's a solid procedure in place for making sure that employees that are on any excluded lists are screened, and you're making sure that those individuals you're not employing those individuals that are excluded on these lists. And let's see, I think that's it for that slide. Can move on to the project approach and work schedule.
Yeah, this is my slide here. Yeah, thank you so much. Okay, so we're talking about the project approach and the work schedule. And this is really the overall philosophy of the program, the provider. So, so you're going to be giving us a brief history of your experience working in the SUD field. Really try to, as Bruce mentioned, kind of around the experience side of it, also include here in the philosophy things that are specific to your services that you're trying to apply for in the RFP, so that can give us a sense of what your focus and your philosophy is for those specific services as well. So when you're also including your resumes of your key staff persons, we want to be able to see that there are on those resumes some related services to the RFP. And we want to get the list of board of directors. We're also looking at getting an organization-wide organizational chart to help us understand the structure of your organization. And then this section here is the cultural responsiveness section. And we're really wanting to be able to describe how your organization is providing culturally appropriate and responsive services. And we're talking about the class. So these are culturally and linguistically appropriate services. This is part of the Office of Minority Health. Kaylee, can you go ahead and put into the chat the link to this? It's also included in the RFP, but I just want folks to be able to have access to this particular website. There's more description about what the different class standards are. There are 15 in total, and you can access that there and be able to use that. Thanks, Kaylee. And then from there, that is what we'll be talking about there. So let me move on to the next one. So as part of the content, this is really the bulk of it. And there was a question I saw about the length of narratives. We'll be sure to answer that in just a little bit. There was a question about like how many pages we can be able to have per narrative. And we'll go into that a little bit more in detail. So the program narratives are for each service type. So this is for all the types you're going to be applying to. You might be just applying to one, you might be applying to more than one. For each of the ones that you're applying to, you're going to put your program description. You're going to talk about the proposed service type itself. And then you're going to discuss the percentage of how much of each of the expected service levels that we mentioned that are all listed in RFP that you are actually proposing to be able to meet. And then how are you going to go about meeting those requirements that need to be able to provide those service types? You're going to describe that. And then you want to also mention the geographic coverage. So then there's a section 2 around the service populations. So these are you're going to describe any of the subpopulations you might be able to serve, or you may not be able to serve in this particular program. So these are things like we talk about the special populations like transition age youth or justice involved individuals experiencing homelessness. Those are some things you might want to include information about those types of subpopulations. And with regards to talking about how you might meet the requirements up in the previous bullet, I just wanted to point out maybe some specialized staffing skills you might want to put in there, any special certifications, or any just specifics about experiencing and delivering the service. All right, that's for your program narratives. All right. So to answer the question about the narratives, there was a question about if you are just applying to one service type, you would have your section around the organization, and that's up to 5 pages. And then each service type was 4 additional pages where you can add your specific narratives about this. Let me go back to the slide, where you're including the program description on all this information. That would be encapsulated in those 4 pages. If you apply to more than one service type, you don't have to redo your 5 pages. You have your organizational. We're asking you to do the additional 4 pages of each narrative. So that's where the additional amount of writing would be related to those different service types. So it's just around those additional narrative pieces. Does that all make sense? Hopefully that's clear. So it'd be 9 pages if you were just doing one. And again, that doesn't include the cover letter or the additional appendix of the budget templates. This is just the meat of it, the narrative portion. All right, so under the content, you're also going to want to talk about the service delivery. So you're really describing the evidence-based treatments that you'll be utilizing in your service delivery. This is also part of the 4 pages. You're also going to talk about your typical length of service provision, and you're going to be talking about the processes that will be used to address care coordination, the transition, recovery issues, and looking at like recovery management, like relapse prevention and recidivism. You want to make sure that you include something around the staffing, and there's a section there that's asking about your organization chart for the program. This is specific to the program. And it's also going to be asking about proposed staff qualifications. Again, you do a staffing section in the overall organizational section on the first 5 pages of your narrative, but this is specific to the staffing for this program. You're going to be looking at discussing the qualifications of individuals in the staffing that would be working on this program. Then you also want to make sure you include all the proposed positions in the section, and they should match the submitted budget templates. Remember that this information should match your submitted budget templates. That is part of your content. I'm going to turn this back over to Bruce to talk about the facilities and a little bit more about the content in this way.
All right. So in terms of information about facilities, we want the address of the locations of all the sites where the services will be provided. And these sites need to meet all federal, state, and county requirements, including Americans with Disabilities Act or ADA. And if for some reason you didn't have the facilities available at the time, you have to describe your plans to secure the facilities. We've discussed it already, but the facilities will need to be certified as well for certain services. As far as regulation requirements, you're demonstrating that you meet the requirements for the service type. So if we're saying that you must be qualified to build drug Medi-Cal for this particular service type, then you're going to have to demonstrate that, or for other requirements like the SABG. Here's where you discuss how you meet those requirements. We want a section on that discusses quality assurance and evaluation, what your plans for ongoing quality assurance, and how you will evaluate the services and the outcomes that you're expecting. And so that's pretty important to see what your plan is for both those things. And I think I'm ready for the next slide. And so if you're not currently providing this service that you're proposing, we would like an implementation timeline. And this may also include an implementation timeline if you are planning on increasing capacity. So maybe it is a service you're proposing, but you're looking to increase the capacity for how many you serve. So this should all be included in an implementation timeline. And then we're also looking at, in addition to the sort of agency level cultural responsiveness information, we're looking for elements of cultural responsiveness that you're planning to utilize for each service type. So if there's things specific to that particular service or category of service, as far as cultural responsiveness, we're looking at that to be addressed here. as well. I don't know, Melissa, if you had anything to add to that.
Yeah, so that might be something, for example, I'll just give an example of like ATP. So maybe you have a high number of individuals specific in ATP that are LGBTQ plus, part of that community. So you might want to talk about any specific kinds of programs that you would be wanting to implement to meet the needs of that particular community. And you could speak about that in this part here. And it's just something, again, related to the trends and what you as the content experts and experts at delivering these services, you would be able to identify on the basis of the different types of programs. So that was just an example. Okay, thanks, Bruce. So Bruce is going to continue to talk a little bit more on the content. We're moving on to the budget templates and the part about cost. We do have Jennifer Pimentel with our revenue management unit, I think, still on the call. So we'll have this here available too as well. And we'll have some time at the end of the Q&A to discuss a little more about this. Bruce?
Okay, so on this section, we've kind of discussed this as we've gone along, though. For each service type, you should be filling out the appropriate budget template as that was indicated. And so the information should be included for each service type on a single template. So what you'll be doing is if you open the service type, the templates themselves, you'll see that there is several different tabs or columns they're called program. So that's where you're going to be listing the information for that service type. So if you had one service type that you're proposing, then you would just be utilizing just one of those columns. And then if you had multiple, then that's where you designate and specify the information for each service type. It's called program in the template itself. So you don't need to do a separate template for each service type. It can be included on a single template. And then, of course, we're asking to clearly state all the costs, both direct and indirect, that are associated with a program or project. And the templates, there's also a section in the templates for budget narratives. And this is a place where you should be providing explanation and justification for all the expenses that are listed. And so this is a very important section as well. Where you're showing, okay, here are the costs, and here's why we have these costs for these services that we're proposing.
Next slide.
And then this is just sort of the additional sections of the RFP itself. You know, if you're planning on having subcontractors, they need to be identified. There's it just discusses the contract terms and insurance requirements. So as part of one of the attachments is a sample agreement with contract terms and insurance requirements. So essentially, you're asked to either agree to those terms, or if you had anything that you were proposing a variation from, then you would need to include that information in your proposal. There is a section also on accessibility standards that has to do with if for some reason, and this may not be applicable, but for some reason as part of the program or project, you needed to have something posted to the county website. There are certain standards we need to make sure that they're all compliant with Americans with Disabilities Act, things like that. So that is just a sort of a standard provision that we have in our RFP. It may not apply, but it's there. There's a section on other agencies' procurements, which offhand, let me just check really quick as to what that is referring to. Once again, these are all sections of the RFP that are in pretty much all county RFPs. So let me just specify that. I'll have to get, oh yeah, here. So that specific section is referring to, oh yeah, so it may be possible that that other departments might want to reference this RFP, and so that's what that's in reference to. Because sometimes when we're doing an RFP, we're doing it for our department, but it may be in some cases that it may be utilized as far as the information collected, and it might be potentially used, could potentially be utilized with potential award for other other departments too. Yeah, and then additional information, anything else that's pertinent, that's not listed, then we're asking you to go ahead and include that as well, that you find important.
Cool. Move on to scoring criteria.
Yes. So so for each, I mentioned it's going to be scored per service type. And so for each service type, it's a total of 100 points. Now that's broken down into information at the agency level, which will, once again, will sort of carry over across all service types, because it's the same information that you're supplying at the agency level for every service type. So that's the qualifications, experience and expertise is 15 points. The information on the compliance programs, 5. The organizational risk assessment that I discussed, 7, and then the information at the agency level for cultural responsiveness is 8 points.
For a total of 35 points there.
35 for that agency section of the scoring, and then for now this information will be different for each service type. Will be scored separately for each service type, and this is the scope of work or the scope of services essentially section, where we have the program narratives, and we went through these in detail before, but 5 points for the description, accurate description, 5 points talking about the service population, 10 talking about the delivery, service delivery, 6 addressing staffing, 5 for facilities, 6 for meeting the regulation requirements, 6 talking about your quality assurance and evaluation plan, 2 points for your implementation timeline, and then 5 talking about the program specific cultural responsiveness. And just once again restating, so that's a total of 50 points for this section, the project approach and work schedule. Reminding you once again, so if you are bidding on service type 3 or 6.2, that there are 5 additional points available if you're qualified to bill DMC for those services. So that would be on top of the 50. And then the last section is the cost section, the budget section, and this is for completing the budget template. The attachments, the appropriate ones, it's 10 points available, and then the narrative specifically, which is actually a part of that attachment, is 5 points, and that's a total of 15. So that brings us to a total of possible points of 100 points for each service type that's being scored.
As well.
Yeah, just reminding you on the attachments. So like, once again, when we looked at the portal, you saw the different things you could download. Now, some of those were just descriptions of like, instructional documents, but I would probably just download everything, just select them all and then save them all. But these are the actual attachments to the RFP. So there is the main RFP itself document, which is a PDF, and then you've got the sample agreement, which I mentioned, which includes the insurance requirements, the 3 different budget templates, which are in Excel. There's a drug Medi-Cal, and then there's the SABG special terms and conditions. And then there's also an additional thing where we define some of the service activities that we're listing. And so we provide definitions of those. That's an informational document attachment. And then there's once again, this is something a part of all RFPs, the living wage solicitation form that needs to be completed. That's a part of all RFPs that are done. That is it. So now we're looking at the actual, talking about the actual budget templates themselves. As mentioned before, there's 3. One is for outpatient and DMC rates and costs. That's probably the one that's cited most often throughout the RFP. Cost-based template is less frequent. And then for those residential programs, we have a residential rates and costs. So those are all available to download. At this time, we're not going to necessarily go into detail on each one. If you've downloaded them and have specific questions, you can bring those questions up. You can put them in the chat, and we can try to address those. But there are actually instructions included in each document too. At the first tab of each document has some pretty detailed instructions too on how to fill these out. So I don't know if any
the Q&A
yeah
at this point. So there were some questions that were already included in the chat. So we've been capturing those as we go along. And if you, at this point, if you want to please add your question, we also, we have Kaylee that's going to be monitoring the raising the hand. So if anyone at this point, I think Bruce, we might want to start with the questions in the chat so I can, some of my notice were related to the cost and finance piece. I know we do have someone from our revenue management unit, Jen Pimentel, is with us. So there might be some questions that come up. Either Jenny, you might want to step in, or Bruce and I can try and answer them as well. So let me see, let's start with a question that about confirming if there was an additional 5 points available, greater than 50% of our employees reside in Sonoma County. How does that fit into the 100 points? I'm not aware of that additional 5 points. Bruce, can you speak to that? The 5 points available if they're greater than 50% of the employees reside in Sonoma County?
I don't believe that's in the RFP. Maybe if just to get a clarifying question from that, like where in the RFP that they're seeing that. Yeah, just because I'm not aware of that. There is on some RFPs there are local preference points available, but for RFPs that have federal funding, that's not allowed. So that wasn't included in this RFP.
Yeah. So Judy, if you have an additional question you want to ask about that, please go ahead and put that in chat. We'll make sure we get that captured and we'll answer that. So, okay, let's see. We're going to move on to the next question.
So we did have another question regarding the residential criteria. So it's kind of a two-part. So does the facility for residential have to meet SABG, class, and ADA requirements? And then does that facility need to be located within Sonoma County or as a surrounding county? Okay.
All right, let me see if we get the first one. So yeah, ADA is, yeah, that definitely needs to happen for regardless of the, so we do need to be able to meet ADA requirements. You're saying for SABG, these are for SABG related services. Okay, and then the class standards, yes, we're talking about cultural responsiveness for the organization. So yes, we're expecting that throughout all of our programs. And then the last question was about the location. And again, we're doing some simple responses here. We're going to take these questions down. We're going to put them into and do an official review. So things might, they'll be more specific, perhaps. They're more detailed responses. So I don't, nothing's here at this point is definitive. So I want to make sure you all know that we will make sure that we put these responses and the questions into that formal addendum process we talked about, and we'll be posting those. And again, you have till August 17, 5 p.m. at that time to submit all these questions. So with regards to the surrounding counties, we're looking at, as Bruce mentioned earlier, we're looking at a proximity and being able to identify that. So there is a potential for some of the services to be able to apply from the surrounding counties. So that is something that is included in the RFP. Bruce, do you want to add to that as well?
No, I think that sums it up pretty well.
Okay. I just want to make sure I'm getting all the questions. Kaylee, am I missing some questions? I want to make sure.
I think that was the only one that was direct to me. And then we did have a question. Is this a reimbursement only grant for client visits?
Bruce, do you want to answer that?
I think we'll have to address that in the in the written addendum. You have to.
It looks like Jody's saying that she saw this in there. Oh, it was that the living wage form mentions that a 5% weighting preference to any service contractor who certifies that 50% of the workforce will be used to perform the service. Interesting. Okay, so it's in the living wage document. So we'll take a look.
We'll have to clarify that too. Yeah.
Yeah, thank you for that. Thank you for bringing that up. Okay, so I don't see anyone raising their hand for any, like, to want to speak up at this time. I hope I didn't miss anyone. Kaylee, did I miss anyone who needed to raise their hand wanting to ask a question? I don't think so, but in case I did. And then I think at this point, I think we answered all the ones that were in the chat that we could. But again, we'll take back some of these questions. We're going to look at them more closely. We're going to be adding to them, and we'll have an official response that will include as part of the addendum that we will be posting. I think August 24th is when we'll post it by. Bruce, is that correct?
Yes.
Yes. So you all have till the 5 p.m. on August 17th to submit your questions. And again, it's to the, oh, Kurt has raised his hand. So I'm going to go.
Yeah, sorry, I got a phone call, right? I didn't know if you.
No worries. Thanks, Kurt.
But just to be clear, this is like only, these are just for visits, right? Reimbursement. It's not like blocked funding for whatever amount and then provided to the facility. It's just like, it's only, the funding is only based on any visits, right? Whether they're individual, group, whatever you covered in this. So I just want to be clear on that.
So yeah, so we're taking that question, Kurt. So we understand your question is like essentially reimbursing for services rendered. Is that what I'm hearing? That's how you're asking it, whether it's group sessions, individual counseling sessions, case management, those types of things.
Right. So the grant funding is based only on visits. That's what I'm trying to find out.
Yeah, we're going to kind of look into it more. That's the direction we're leaning. Before we give official answer, we want to do some research to make sure that we give you the correct answer. But if we understand the question correctly, I think that's referencing the service provision portion of it and how you're going to be, what you're going to be providing, and that's what we're looking at. So I think that is the answer. But again, we'll have an official response. Bruce, anything to add to that? Anyone else? That I think we're Jen, if you're on there as well, that's my understanding that is correct. And I just want to make sure if we have, we also will look into it to confirm that and have an official response.
Okay, thank you.
Sure.
And then it looks like we have a question from Matt Shimbari.
Yeah. Hey, so I'm a little new to this process. Forgive me if this is something of a silly question, but so I represent a program in Napa Valley that it's owned by a healthcare corporation. So it's essentially a for-profit, privately held rehab residential facility. Would we qualify for this, or do we have to be sort of a nonprofit organization in order to apply for this funding or these bids?
Great question. So Bruce, Jen, anyone want to respond? I don't know where Bruce is. Bruce, are you on mute?
No, I'm not. Just trying to think about it. It may be. So you're basically saying that if you're in Napa, if you can apply.
Well, you had already mentioned that if you are in kind of surrounding counties, yeah, there may be a potential because you're just sort of looking for proximity resources. But I'm talking about specifically the fact. So we aren't contracted with Medicare or Medi-Cal normally. We're not able to take those insurances. We usually operate off of private insurances like Anthem Blue Cross and Aetna and that kind of thing. So what I'm asking is would we be eligible to basically bid here, or is this just for like state and county run organizations?
Well, so I would ask that you kind of put all those elements of that into either the chat here or an email to the DHS contracting thing, and so we can address all the elements that you're talking about. But so not all the service types are requiring that you be qualified to build drug Medi-Cal. Some of them are, and some of them are not. So I would offhand, I would say that you would be eligible if you meet the requirements for the other ones. If that happens to be the SABG grant, the SABG grant, or other ones that don't specify a specific requirement regarding the funding, then I would probably say you'd be eligible for those as long as you meet all the other requirements. So that would be my initial answer. But once again, if you kind of put all those elements into a written form, then we can address all of it fully.
Sure.
Thank you for that.
Yeah,
Thanks,
absolutely.
Matt. There was a question here directly to me about asking, I want to make sure I just get this on record, if it's possible that resolve the RFP process that if supported by the cost of providing service, providers may receive an increase in the daily costs or daily rates from the county. So we'll go ahead and review this, and we'll put that into the formal responses as part of the addendum as we talked earlier. Keely, were you able to get that question? Shall I read it again?
I got it.
Okay, awesome. Thank you so much. Okay, I think there are a few more questions in the chat that I don't want to miss. And I don't know, Kaylee or Bruce, if you received anything directly, if we could just also verbalize those so we can make sure everyone can get that information.
I think the last one I see that has not yet been answered is, I see an additional 5 points can be earned if a program can bill drug Medi-Cal. So this is kind of a follow-up to what we discussed. Does this mean if we are drug Medi-Cal certified? And then it says, even though ODS DMC is not active in Sonoma County, and this is specific to perinatal residential.
Okay, great question. So yes, we capture that, and we will be sure to respond directly into the formal responses. And yeah, so I think, right, even though we're not ODS DMC, but we're looking at that. So we'll definitely be responding to your question directly into the formal responses. Thank you for that as well. So I think if there's anyone else who wants to raise their hand, like I said, we're trying to capture all of these questions, and we have gathered all of the ones out of the chat so far, whether they were directly sent to us or to everyone. And we'll make sure that if we haven't fully answered it, and even the ones we have answered, as I mentioned, we will be reviewing them, and they're probably more comprehensive responses. We want to make sure that we give you the most up-to-date, accurate, and complete answer that we can. So, and they will be the official responses, and they'll be located, as I said, in the addendum. But if there aren't any other further questions, I want to make sure we do give enough time at the end to have anyone raise their hand or write into the chat. So I'm just going to give a little time for folks to do that. But if you're still typing, I know it can take a little bit to type in. Perfect. Thanks, Matt, for that. Matt just added the question, so we have it officially recorded here. Thank you, Matt. Give a little more time for folks to add in the questions. And we were so grateful for you all coming today. I just want to thank everyone for being here and for helping us to. Oh, can you email a video copy of the Zoom conference? Yes, it was recorded. The recording will be posted. Correct, Kaylee, yes, so you'll be able to get that available to you then on the website. Can you go ahead, Kaylee, and put that again into the into the chat so folks can know where to find this PowerPoint as well as the recording. And we're looking, Ben and everyone, we're looking to get it posted by tomorrow at the latest. So we're working to post not only recording, but also the slide deck itself. Great, thank you, Kaylee. Good questions. I don't see any more hands or questions in the chat, but I know it can take a little while for folks to type up. So if you're typing anything, I don't want to miss it. All right, let's see. Yeah, absolutely. Thank you for being here. Thanks for the information. It's a lot. We realize that, as I mentioned. So hopefully by having access to the slides, you'll have that. Like I said, we also will give you the notes that are part of it. There's a subsection where it talks about a little bit more information. And of course, the RFP is comprehensive and does include additional information. And as Bruce mentioned, there are some attachments, such as descriptions of the different service areas and service types that you can be able to download directly off the Supplier Portal. So there are some ways that you can get some additional information from that as well. But at this point, any formal questions, any additional questions you might have, remember to please use the the process that we've established, which is through the email. And I'll have Kaylee put it in one more time in the chat in case you've come late to the conversation. So this is where you would be submitting your questions. And as again, I'll just do the dates and times again. In fact, I'm going to put that slide deck back up, that particular slide, just so you can see the timing. I think that would be helpful.
There's also
I'm sorry.
the last slide has a few of the key upcoming dates too as well. So yeah.
Okay, so last slide. Oh, there we go. So this is the one that has just the reminders about when to submit and when we will be doing the responses, the formal responses. So yes, you have till 5 p.m. on Tuesday, August 17th. And there's the email address. Sorry, I had Kaylee. I also put it in there multiple times, but it's better, the more the merrier. I think it's better to have access to all this information on multiple occasions. And then we will do the addendum to the RFP with the formal answers, or official answers to the questions. And that will be posted to Supplier Portal on August 24th. And then, of course, your proposals need to be submitted electronically, as Bruce mentioned, electronically. And I know we mentioned this earlier, but I'm just going to reiterate that we're preferred format for the proposals is a PDF, and then except for the budget templates, we're asking for it to be in Excel.
Yes.
Okay, and so that the proposal should be submitted again, but electronically through the Supplier Portal by 2 p.m. on the 7th of September. And that is the link. And we've had it up here in the slide deck as well. And there's also, it'll be in the chat. Hopefully you were able to capture one of these forms. Great. Well, we just thank you again for everyone for being here. I saw a few more things come up in the chat. Let me just make sure I didn't lose anything. Oh, it's just the emails. Thank you. And information URLs that were put in there. Thanks, Kaylee, for that. All right. Well, we really appreciate everyone, and we look forward to getting any additional questions, and we'll be looking through those. And like I said, we'll be making sure to respond to the questions that came through today. So look out for those. Thank you.
Thank you.
I think
Thanks,
we're going to
everyone.
conclude at this time. Thank you so much. Bruce and Kaylee, can you hang out for a bit? Want to make sure we get the recording and all the chat and everything. Wonderful.